Hi everyone, it's Natasha Trenev, and today we're going to talk all things Helicobacter pylori. You might know this bad bug as H. pylori, and it's found, to cause stomach ulcers, a weight gain. It can also cause a myriad of problems, especially when it joins yeast to try to take advantage of your body. And it's probably involved in something that's very prevalent right now that we call SIBO, SIBO, which means small intestinal bacterial overgrowth. And this organism has been around with us for well over 11,000 years. If you're wondering, how they detected migration of certain groups across the continents, it's because they found this bacterium associated with their remains. So we know it's been around for a long time. It's cohabited with us. And the most important for you guys to know that if it's found in more than 50% of the world population, it can be transferred to your family members. It can be transferred because of lack of sanitation. And in Japan, where they have a problem with this bug, they have a large number of stomach cancers because of this H. pylori organism. So it is a problem, and we need to learn more about it because it can become a problem that cannot be solved with just, pharmaceutical drugs. Now, what I'm about to tell you is for information purposes only. I'm not giving you medical advice. I'm advising you and giving you information that you need to utilize to best form an opinion how you want to proceed and what you want to give your body to heal itself. So many people don't know that they have H. pylori. So what are some of the symptoms that people have when they have H. pylori? It's probably abdominal discomfort or pain. You actually feel pain in your stomach. Appetite loss, you don't feel like eating, nausea, vomiting, bloating, belching, and fatigue. Because when your body's not processing food, it's not creating energy, so you're going to feel fatigue. So if you're feeling these symptoms, and usually what starts happening when these people have H. pylori, they start getting excess gas. Now, I mean, not just excess gas, which is very embarrassing, but they also have excess stomach acid. And the first things we do in our society when somebody has excess stomach acid is give them something called a proton pump inhibitor, which is a drug that sort of tells your brain to stop producing acid in the stomach, or they use anything to neutralize the acid. And why this is only something that should be used temporarily is because when you neutralize the acid, you're allowing this bacterium to form more holes in your stomach lining and compromise the health of your stomach. And that's why it's very dangerous to use proton pump inhibitors for a long length of time when you have this infection. Now, interestingly enough, the medical therapy for this is two strong antibiotics. One is amoxicillin and the other one is erythromycin. You have to take both of these antibiotics, and they'll give you something called a proton pump inhibitor. You can find it in your regular pharmacy, or they'll give you Pepto-Bismol. Now, they usually give this therapy to you for 7 days. And after 7 days, they have about 72% eradication. And if they give you this triple therapy for 2 weeks, you can have 82% eradication. But let me tell you, there's always something in microbiology we call the survival technique. No matter how much you try to kill a bacterium, there's always going to be a 10% survival rate. So they're going to be there. So now you've had this bacterium, you think you've gotten rid of it, but what happens now? What they found in the Western culture is that if you take this triple therapy for 7 or 14 days, and the reason they stopped the 14 days, as I said, is because they were afraid of antibiotic resistance, because these bacteria will develop a resistance. So what happens? They found that when people have this triple therapy, there has been a huge weight gain in the population. This is something they can't figure out. They're saying that they're seeing this huge rate of obesity because now the eradication of the H. pylori, instead of making it small in communities and controlling it, by eradicating it. They haven't figured out why, but there seems to be a growth in weight gain. So this is one when you play with drugs and you don't know how to set up an optimal uh, microbiota organization in your GI tract or throughout your body. And what you want is an optimal balance, not just an optimal organization. You want an optimal balance. And that's why you need to have a natural approach to dealing with these bacterial overgrowths, because as good as antibiotics are at saving your life, we have found that antibiotic therapy sometimes predisposes us to a lengthy other problems that we're not aware of. And by the way, there is separate research that shows use or abuse of antibiotics on a regular basis will lead to weight gain. Because just as a aside, did you know that the farmers were using antibiotics in feed not to keep their animals healthy? But the reason they decided to keep adding antibiotics to their feed is because they found their animals would gain weight and retain water. And guess what? They sell their animals for slaughter and for use by human beings based on their weight. So when you think about the correlation of using this triple therapy of antibiotics to get what they call eradicate H. pylori, which they never do, means that you're subject now to weight gain. So now that I've presented the problem to you, let's look at some of the other actors in this association. So I just want to tease you because I'm starting a whole training campaign, which you can catch every Wednesday at 1 p.m. Pacific Daylight Savings Time. And you can come to our website, which will be able to find where you can join me. And I'm going to be giving much more details about these problems. Right now, I'm just giving you an overview of the problem of H. pylori. So if I can see my slide, I'm going to show you how these bacteria form unusual associations to protect themselves against antibiotics so that they can survive. Remember, I told you you can give the strongest antibiotics for the longest time, but there's always going to be a 10% survival rate, and this bacteria is going to hang around. And guess what? H. pylori is associated not only with small intestinal bacterial overgrowth, but it's associated with stomach cancer, esophageal cancer, and possibly even some cancers in the upper small intestine, which I'm now investigating to find out what's going on. So having said that, now look at this. We all of us who have been in the health food industry know about Candida. Candida is the very pathogenic yeast that everybody needs to get rid of. And believe me, in Western societies, we all have a bit of Candida that's out of control because of the amount of pollution and antibiotics, which are used as pesticides in our situation, and the oral antibiotics we've been taking. So Candida is pervasive in most Western societies, especially in North America. So look at this relationship. So H. pylori will get protection from Candida so that it can avoid the action of the antibiotic, because guess what? Yeast are not affected by antibiotics. That's why it's dangerous when we start abusing, remember I'm saying abusing antibiotics, because it allows pathogenic yeast to grow and then form these alliances with pathogenic bacteria to take advantage of our body. So let's see what my slide says, that this is a presentation I've been doing for many years. So gastric ulcers are caused by Helicobacter pylori, which I've told you about, which is a very nasty bacteria. So it colonizes the mucus lining. You know, your stomach has a lining of mucus that protects it from the hydrochloric acid used to digest proteins in your stomach. So, and interactions are often accompanied by an overgrowth of Candida albicans yeast. Okay, so the yeast that might be there, and you're throwing in antibiotics, you're eliminating the competition, but the yeast decides it wants to form an association with the H. pylori because now it's decided it has a partner in taking advantage of you, the host, which is quite nasty, I might add. So the yeast creates a buffer from these acids in your stomach, the heat, the dehydration, and the antibiotics. In the case of long-term non-healing ulcers, 20% involve H. pylori exclusively. and 72% involve other microflora, now they're called microbiota, candida, and pathogenic organisms. So whenever you look at one bacterium, think about what other nasty combinations it could make to try to take advantage of you, the host, because it has no incentive to keep you healthy. It's only there to promote its own kind. So if you look at this micrograph, you can see the Helicobacter pylori. It's this long, sort of sausage-looking one with projectiles at the end, and the yeast is this little round thing that's close to the H. pylori. So now, if the yeast is now allowed to overgrow and get into your small intestine, it's going to start changing its shape, and it's going to grow long projectiles that's going to attach itself to the intestinal wall and pump poison into your body. So not paying attention and not knowing what to do when you have an H. pylori infection, when you get these signs, and many young women suffer from this SIBO that I believe is also caused by H. pylori, and I believe an E. coli is also involved in SIBO. So there's a multitude of organisms along with candida that is now taking advantage of your body. And interestingly enough, with about maybe dozens of studies of specific lactobacilli, which are probiotics, and bifidobacteria, we found that you can have 80% eradication of H. pylori without causing the fungal overgrowth. So if you are suffering from too much stomach acid, if you're suffering from gastric pain, nausea, vomiting, and you are under the care of a doctor, I would suggest that you would look at your diet and you would incorporate, good, what I call precision probiotics to aid your body to develop a normal digestive process, which is necessary when you have an overgrowth of H. pylori that can take care of those problems like nausea, bloating, belching, loss of appetite, no energy. How many of the women suffer with no energy, bad skin? Believe me, it's going to start hitting your skin, because when your body can't throw off toxins the natural way, it's going to come through your skin. So that's why a precision probiotic protocol is so important when you have H. pylori overgrowth that's in combination with the yeast and possibly other non-friendly pathogenic bacteria. So what I recommend is that you start with 1 teaspoon of the megadophyllus in unchilled filtered water 4 or 5 times a day, especially before you eat. Make sure you take this religiously. Cut the number of carbohydrates you're eating. Stop eating raw foods. Make sure your food is well cooked and natural, and that you stop eating raw vegetables and raw fruits for a while until you settle your stomach and get this microorganism under control. And I would do that for at least several weeks, maybe up to a month. Then on top of the megadophyllus that you're taking, I recommend improving the microbiome throughout your intestinal tract by taking 1 healthy trinity twice a day. And believe me, it is not an expensive therapy compared to what you will go through if you don't take care of this on time. Because I think what we've all missed in Western cultures, we have a lot of gurus and a lot of people telling you about gut health, but I don't know of anybody that spent 50 years in this industry, has specialized in probiotics, has specialized in gut care, and has worked with some of the top people in the field for candida and other problems, OBGYNs, internists, dermatologists. I've worked with almost every type of medicine you can imagine. And all of it is really not segregated or apart. The body is one. And since you are a hybrid of microbes and human cells, you need to be able to tell those symptoms. You need to be able how to take care of them. So let's repeat this one more time. So if you are suffering from belching, indigestion, acid reflux, if you have you're constantly tired, you're not able to function and think clearly because your stomach is now not digesting, and you could possibly even have nausea and vomiting, you have a problem in your stomach. So as soon as you can, stop eating the raw foods. Please stop going to the juice bars. I'm going to have a separate session and remind you again that those juice bars are deadly. Not because the juice is bad for you, it's the hygiene. You're probably aggravating your H. pylori overgrowth by drinking those juices in machines that don't get cleaned in 8 or 9 hours, and you have no idea what's growing in those machines once you start breaking down those fruits and vegetables within an hour. So if you have this problem, please stop drinking any raw juices, anything raw. Give yourself a month to get your body back into shape. Remember, take the megadophyllus powder, it's dairy or dairy free, 1 teaspoon, 4 to 5 times a day, in about 6 ounces of filtered, unchilled water, or anytime you're feeling bad. You can't overdose on this because it's not a drug. We're not treating symptoms. We are giving your body the tools so it can heal itself. Take a healthy trinity once in the morning and once at night. Do this for a month, and let's see how you can get healthy and help your body. Give your body the tools. It's a magnificent machine, and it can heal yourself. So remember today, what did we talk about? The overgrowth of a nasty bacteria called Helicobacter pylori, sometimes referred to as H. pylori. We talked about its nasty combination with the yeast and how it protects itself in the stomach. And B, what happens if you eradicate H. pylori with antibiotics? The science has shown that you're going to gain weight. You will gain weight if you use the antibiotic therapy because the science shows it. I'm not telling you not to use the antibiotic therapy. I'm saying do something to restore the natural microbiome so that we can find out why there is a weight gain when this H. pylori is eradicated. And the more you learn about bacteria, and not just simple sections, oh, take this soil bacteria, take this 8 or 10 bacteria in this product, with people who have no idea what they're selling you, and they're only interested in treating a symptom. We have a huge problem in North America with a lot of these horrible problems that people really don't have a simple solution. So again, stay tuned. I'm going to teach you more about yeast overgrowth. I will talk more about Helicobacter pylori. There's another nasty organism called Campylobacter pylori or jejuni. And these names you don't have to remember. I'm not going to test you. But the more you learn about what's causing the problem in your body, and I remember what I have always told you, that the source of every disease state in the body has its origin in the GI tract. And people are given very simplistic solutions to a very complex problem. And if those solutions have been working, we wouldn't have 80% of our population chronically ill that are on our health, I would call it a sick care system, within a healthcare system. So something is wrong. We have alternative medicine available for 80 years, and people are still not better. So we have to examine everything: the water, the soil, our stress level, the hygiene. Most people are not taught hygiene at home. Check all of those things, your hygiene at home, how to prepare food in your kitchen, how not to touch your mouth. And by the way, if you have H. pylori, your partner, your children, your husband, your relatives will all get infected. They may not show sign of infection because your immune system is okay and able to tolerate it. But everyone who lives in a household with someone who has been diagnosed with an H. pylori infection, trust me, within a matter of days or months, that person will also be infected, even if they don't show signs of it. So be proactive. That's why I'm telling you, I didn't make the rules. That's why I'm asking you to make sure that you are at all times protecting your precious microbiome, that you know what foods you eat, that you know what supplements you take, because the wrong supplement will not only not help you, may also have a problem for you in the future. So take the right precision probiotics, eat a low carb diet if you have an H. pylori overgrowth. Make sure you stop eating the raw foods for at least a month, and listen to your body. Your body will communicate with us. So if you have any questions, please, tell everybody about these lectures, because I have 50 years of experience. I want to share this experience with you. I'm developing learning management systems so that everybody can learn and apply this knowledge to make themselves happy. Excuse me. Anyway, to make everybody happy in your family. Thanks for listening. Come back next Thursday and we're going to have a very exciting, I don't know what happened, but something is caught in my throat. But we're going to have a case where we're going to show you how one woman got rid of her rosacea by taking care of her gut. It's an incredible story. I remember beauty begins within. So I got to stop because I think my throat is telling me it doesn't like me anymore. So thanks for coming. Tell your friends. Let's get the message out. It's like the old days. We need to inform people of the right information. See you next Thursday.